Hello, I'd like to introduce you to a healthier you. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and I co-host the show It's About You on WKYC, where I lift up people that are doing great things in our community. We call them everyday champions. However, today, this segment is about you. Yes, it's about your health. I wanted to partner in this community with a great hospital that could help you through your daily routine and to make you a healthier person. So I'm here with University Hospitals, making sure that you are the best when it comes to your health. And so today I'm speaking with Dr. Lisa Rock of University Hospitals, and I'm so glad that she's here with us today. How are you, Dr. Rock?
I'm doing great.
That's good. So what's our topic for today?
Today we are going to talk about benign breast issues. So a lot of times when people think about the breast, they think of breast cancer, but there's a lot of issues that are not cancer that women have that they see their physician or a breast surgeon for. So I wanted to talk a little bit about that today.
That's a very important subject. I know in our community, we see that quite often. So if a woman finds a breast lump, is it usually cancer?
No, actually, it is usually not cancer. 80 to 85% of the time, the lump is not cancer. Wow. So I usually tell people, don't panic or don't, freak out when you find a breast lump, because most times it's nothing to worry about. It can be, so that's something that has to kind of be figured out and worked out, but, don't panic. A lot of times it's nothing to worry about.
Key word is don't panic. So there's, I'm sure, different kinds of benign breast lumps. What are the different types?
So one of the most common type is something we call fibrocystic breast disease, which I don't really like the term disease, but it's an issue that can happen in the breast. It's normal breast tissue, but for some reason it kind of can feel like a lump. And it's very common. It's usually painful and can fluctuate with the menstrual cycle. So a woman will notice a lump that maybe gets bigger and smaller throughout the month. And that's usually what we call fibrocystic breast disease. There's a lot of things that we can do to treat that. You can just do something simple like over-the-counter, non-steroidal, anti-inflammatories, wearing a supportive bra, heating pad, things like that. It's very common and something that we usually see.
I like that. Now, a lot of women also deal with pain in their breasts. So I wanted to ask the question, what are the typical causes of that pain?
So breast pain, it's a big issue, and the issue with breast pain is a lot of times we don't know actually what causes it. And so if we don't always know what causes something, it's kind of hard to treat. Mm-hmm. So the treatment can be a little bit all over the place, but often the most common thing that causes breast pain is hormones. So again, it can be related to the menstrual cycle. It can fluctuate throughout the month. Mm-hmm. And breast pain can be that type, but it can also be a pain that's not cyclic, that doesn't relate to the menstrual cycle. And that we usually see in older women. Mm-hmm. That tends to be maybe just one breast, where the more cyclic pain tends to be in both breasts. But hormones are the biggest cause of that type of pain. The other things that can actually cause breast pain is caffeine. People that drink a lot of caffeine can have more breast pain. And actually, smokers tend to have more breast pain than non-smokers. So those are also issues that we look at.
Wow. So cut down on the caffeine and cut down on the smoking. Sounds like a good tip for the day. Also, is there any breast pain linked to cancer?
Yes. Breast cancers can cause breast pain, although less than 5% of breast cancers are actually, one of the main symptoms that somebody notices is pain. Mm-hmm. So again, when we see somebody that has breast pain, even though most times it's not cancer, we don't just say, hey, don't worry about that, it's not cancer. We still do a thorough workup and look into everything to make sure that that's not the issue. But again, most times cancers do not cause pain in the breast.
Gotcha. So how do we treat the pain in the breast?
So again, since the underlying cause can be a lot of different things, there's a lot of different things that we try. Some things are very simple, and even by the time a patient has seen me, maybe she's tried most of these things. Mm-hmm. But there can be, again, the things we talked about, cutting back on caffeine, or trying to stop smoking, which we all know that's very hard, but that is helpful. But usually something like an over-the-counter anti-inflammatory. So again, something like ibuprofen or Aleve, a heating pad or a warm compress. If it's just one spot, that oftentimes can help. Mm-hmm. Sometimes a different type of bra, maybe a more supportive bra, or if somebody is having a lot of pain at night, maybe wearing a soft bra or a sports bra at night can also help. but there are two vitamins that can help with breast pain, and these have been studied. They've been looked at, and one is vitamin E, which is very simple to take. It's usually the dose that we recommend is something higher than you would get in just a normal multivitamin. But 50% of women in studies have less breast pain on 400 international units of vitamin E a day.
Oh, wow.
And the other medication, or more like a vitamin, is something called evening primrose oil, which is sort of more like an omega-3. It's also has been studied, and 50% of women will have less breast pain. So those are two things that we can try that are pretty simple. They're easy to take, and most women don't have a problem, with them interacting with other medications and things like that. There's also some topical things. We have some creams that are sort of a non-steroidal cream that can help with breast pain. And for most women, those kind of things help. And a lot of times I think women are very concerned and worried that it's cancer because they have pain or something going on. And a lot of times just reassuring them that, that's not the issue. It's something that's very normal, and it's not usually a cause of, cancer. And, they at least feel better about it and can kind of handle it a little better, knowing that, everything's okay in the long run.
Right. And it's good to know there's something you can do about it. I know there's been a lot of challenges also when it comes to nipple discharge. Can you tell us about, is that a normal thing?
It is normal. And a lot of women are very surprised when I say that, but it's just the kind of thing that women don't talk about all that much. But nipple discharge is very common, and it can be very normal. So we do see it a lot, and we, there's certain things about it that we look at that make us more concerned at times than other times.
Yeah, I was wondering, so is there any signs that nipple discharge could be a sign of breast cancer?
Yes. So nipple discharge that is bloody is one of the most common ones that can be associated with cancer. Although, having said that, even most times when a patient has bloody nipple discharge, it's still not a cancer. But that's what kind of alerts us that we have to look a little bit more closely. But almost any other color of nipple discharge, whether it's green, clear, yellow, brown, any of those colors typically are, very normal. Now we look at it, and sometimes we can take the fluid and send it off, be tested for cancer. And, we always want to do a good exam, of course, and a mammogram and maybe an ultrasound to look behind the nipple, because sometimes you can get small growths in the milk ducts that are something we call papillomas that are very common, and they're not cancer, but that's the most common thing we see even with the bloody nipple discharge. But again, a small cancer that's growing in the milk ducts behind the nipple can also, cause bloody nipple discharge. The other thing, sorry, a little bit more the blood work that we look at when somebody has nipple discharge, because low thyroid levels can actually cause nipple discharge. And then we send a blood sample for something called prolactin, which is a hormone that your body makes. And if it's high levels, that can mean that there's actually a little growth in the brain that's causing the nipple discharge. So those are things that we look at too.
So is there a sign when you see it to call the doctor, or?
Well, I think anytime it's bloody nipple discharge, or if it's associated with a mass, if you feel a mass and have nipple discharge regardless of the color, that's also something that should be looked at.
Got you. Well, I appreciate it. I appreciate all the knowledge that you've given us, Dr. Rock. And I want to thank you again for expanding our knowledge and sharing with us what University Hospitals is doing to build a healthier you. And so that's our segment for this week. I'm glad to all of our viewers that are tuning in. Make sure that you continue to contact me on social media and also on my website, LarryMaconJr.com. Or for further information, make sure that you contact University Hospitals with your health concerns. Remember, good health is good wealth. Thank you again, Dr. Rock, for being on this segment with us.
Thank you, Pastor Macon. I enjoyed it. Have a good day.
You too.
Bye-bye.
Bye-bye. That was perfect.
Okay, good.
Did you feel comfortable? I thought it was very informative. I think it was great.
Good. All right. Yeah, it was great. It was nice. I was happy Vitella reached out, because I thought, we haven't been able to do any live person, talks and things like that. So this is great. It's wonderful that you're doing this.
Thank you. I appreciate it. We're going to keep trying to get it out in the community.
Sounds good.
All right. Well, you take care. You have a
have a good day.
All right. Bye-bye.
Okay. Bye-bye.